Good morning, everyone. Welcome to this January 20th, 2021 meeting of the Education Finance Committee. Remote hearings are held in accordance with House Rule 10.01. This rule has been posted online and is linked in our public meeting notice on the House website. All remote hearings will be recorded and live streamed by House Public Information Services. Members, you have the contents of in your virtual packets available to you, and for the public, those same materials have been posted online. Members, if you're looking for all those items in one place, they are attached in the calendar event that you received from Ms. Burt today. To get on the list to be recognized by the chair, members using the Zoom interface have the ability to raise their hand via the app. Ms. Burt will place your name on the list to be recognized. If a member is on their phone and doesn't have access to the raise your hand feature, please email Ms. Burt and she'll put your question in the queue. This is the digital equivalent of getting the attention of the chair or the committee administrator. An email from your House account with the subject, "Please recognize," is all that is required if you're on the phone. Ms. Sunderland, would you please call the roll for today?
Chair Dabney.
Present.
Vice Chair Sandstead.
Present.
Representative Kresha. Representative Kresha. Representative Bennett.
Present.
Representative Daniels.
Present.
Representative Damath. Representative Damath.
Present.
Perfect, thank you. And Representative Drazkowski.
Here.
Representative Erickson.
Present.
Representative Feist.
Present.
Representative Jordan.
Present.
Representative Marquardt.
Present.
Representative Mueller.
Present.
Representative Richardson.
Present.
Representative Thompson.
Thompson present.
Representative Wolgamott.
Present.
Representative Zhang.
Present.
Representative Joachim.
Present.
Representative Kresha. And that is the roll, and we do have a quorum.
Thank you very much. Representative Sandstead, have you had the opportunity to look at the minutes from our Tuesday, January 19th meeting?
I did, Mr. Chair, and I would so move those minutes.
Thank you very much. Members, this is a voice vote without any objection to approving the minutes from Tuesday, January 19th. Are there any objections? Hearing none, all those in favor of approving the minutes, please signify by saying aye.
Aye.
Aye. Opposed? Motion prevails. Thank you, Representative Sandstead. Members, this week we'll be continuing with a series of informational hearings. Yesterday, we heard from the state agencies and boards that fall within our jurisdiction. Today, we'll be hearing from the Minnesota Department of Education and the Minnesota Department of Health. So please, members, feel free to ask questions once the agency or board has concluded their presentation. I will hand it over to the experts. Assistant Commissioner Huff, welcome to the committee. Please state your name for the record and proceed with your testimony.
Chair Dabney, members of the committee, thank you for inviting me to present today. My name is Dan Huff. I'm one of the assistant commissioners at the Minnesota Department of Health. And can we have the presentation up? Right. Mr. Chair, would you like me to start into the presentation?
Would you please?
Very well. Next slide, please. So we are at an interesting crossroads with the coronavirus pandemic. We know that COVID is a serious disease. It has resulted in over 400,000 Americans dying, close to 6,000 Minnesotans. We know, however, that there are also many other public health impacts that have occurred just because of all the restrictions and all the changes in our society due to COVID as we attempt to limit the spread of the disease. One of those is in public education. And education is important to public health. Education is an important social determinant of one's health outcomes during their life. Higher educational attainment is correlated to higher health or better health outcomes. There are also just schools are an important part of our public health system. This is where children are often fed. It's where they receive notifications around vaccination, early childhood screening. Often it's our educators and our staff and our nursing staff in schools that are the first to identify issues with our children so that they can be referred to other specialists for more intervention. While students have been out during much of this pandemic, they have suffered in many ways due to that. Next slide, please. If we, however, have kids in school, we need to make sure that we're doing it in a way that is safe for both the children and the adults that are in class with them or in the schools with them. The CDC provides some recommendations in what they call a continuum of risk. We talk a lot about risk with the Minnesota Department of Health, and it's because anytime we interact with someone outside of our household pod, there is a risk of either spreading or contracting COVID. That's just the way an infectious disease works. The more interaction we have, the higher the risk. However, we can do things to mitigate that risk. And the CDC outlines those here. And I want to go to those bulleted things here because you'll see when we get to Deputy Commissioner Mueller's testimony that we have really focused hard with our safe learning plan to implement these mitigating factors. So one is just consistent and appropriate use of masking, social distancing to the largest extent practical, hand hygiene, washing our hands, respiratory etiquette, that is, covering our cough, and then the contact tracing. And that's where local public health and MDH partner together to make sure that we follow up with anyone who is infected and anyone who may have been exposed to them in school settings. I want to turn to the top here. This is a very important line, the number of cases per 100,000. The lower the number of cases in an area, the less likely you are to be exposed. The higher the number of cases, the more likely you're to be exposed. Every person that we have, that's just one more way to open up exposure risk. The CDC recommends, and it makes intuitive sense, the lower the spread within the community, the safer it is to go back to schools. That's why all of the mitigation measures, the governor's dial back measures, everything that we're doing throughout society of masking, of social distancing, all of these are vitally important to getting our schools back open and staying open. It's keeping that case rate down throughout Minnesota, not just in schools, because there is no magic wall between one sector and another sector when an infectious disease is concerned. Next slide, please. So, as I said at the beginning, we know that the pandemic has impacted children, has impacted families. This is especially true for families that are already dealing with other issues. So whether it be special education, low-income families, BIPOC communities, inequities have only been exacerbated through the pandemic. Next slide, please. Healthcare access. Our children are not accessing healthcare as much as they did before the pandemic. That goes for vaccination, that goes for just preventative care. Some of that is just the fact that we are where we are in our society, but other parts of it is related to schools, because schools are really that first, it's that area where many of our children enter the system. It's where they are contacted or referred by educators. Next slide, please. Early childhood screening is down. Most screening happens in schools. And we see that is down from a year previous. Next slide, please. Now, this doesn't necessarily relate to children, but it is transferable. I think all of us can relate to this. This has been a very, very difficult year for us. It's now been 12 months since we started working on COVID at MDH, when it really began to be apparent it was coming to Minnesota. That's been hard for all of us, and everyone's mental and emotional health has suffered, no less so for our adolescents and our children. Next slide, please. Schools are really an important place where many of our children receive their basic nutrition, whether it be a school lunch or school breakfast program. Now, our schools have done an amazing job partnering with our community and under Governor Walz's COVID plan to make sure that people do not slip through the cracks. We've done an amazing job of still feeding children throughout the state. However, this is still a significant issue. Food insecurity plagues our children, and without schools in session, that's only exacerbated. Next slide. Schools are often the place where abuse or neglect, other child welfare issues are recognized. They're recognized by our educators, by our staff, as mandated reporters. Without those referrals, maltreatment reports have gone down. Also, our case management has suffered because we've had little or less stuff in-home or in-person contact. It's all the fact that we're dealing with this extremely contagious disease, but it does mean that our child welfare investigations are down and cases are down, while anecdotally we understand that, you know, families are struggling, stress is high, and there may actually be more abuse or more neglect occurring just because of the stress of the pandemic. Next slide. So I think all of those things we understand, but it's important to think, okay, so what about the disease itself? COVID is highly contagious. And what does it mean for what's happening in school settings? Do we have cases in schools? Yes, yes, we do, as we do with every area in our society right now. And what we can see is proportionally between students and staff, we have those that are attending while infectious. Please remember that we're infectious even before the onset of symptoms. So that's one of the tricky things with this disease. But if you look at the proportion of students that are in and faculty that are in, we know that in elementary and in secondary, it's about the same. So about 75% of faculty that were infectious, attended while infectious in elementary is the same as secondary. So what we find here is that that percentage or proportion is not much different between secondary and primary education. Next slide. One of the things that we looked at then, are schools the driver? Are schools driving infection within our community? Now, we know that whenever people are interacting outside of their household, that can drive infection and that can lead to community spread. But are schools significantly different than the broad environment of what's happening in the state? And we know that in the fall, November, we hit a incredibly high spike in cases. The disease was widespread throughout Minnesota. Really, very few settings were safe just because of how much disease was out there. It was very likely that if you were to interact with someone outside your household, high likelihood they might have the disease and spread it to you. So what we did, this is a confusing scatter chart. It has a lot of caveats to it. But what we found is we looked at schools in session and number of cases in that age group, the cohort of kids in school, over time. And how did it change? Did it change significantly from when those school districts were in session, or were they out of session? You'll see that the incidence didn't change that much. It's really, you know, there's a lot more kids in session, but what we found is it was less to do with kids in session and more to do just the general community. If there are higher doses in the community, there are higher doses in children. When there are lower doses in children or in the community, there were lower doses in children. What's important about this chart is it just showed that there was no glaring alarm bells that said, wow, there's so many more kids being infected when they're in school. What we found is that all the other just big noise from community spread outweighed our ability to even detect that. Next slide. Okay, with this, I'm going to turn it over to Dr. Mueller.
Good morning, Dr. Mueller.
Good morning, Chair Davney. Good morning, members of the committee. Thank you very much for having us today. Are you okay with me continuing with the conversation?
Just please introduce yourself for the record before you proceed.
Yes,
Thank you very much.
Yes, my name is Heather Mueller, and I'm Deputy Commissioner with the Minnesota Department of Education. And I want to thank Dan for his joining me in this presentation. So as we look at the data that we have available, we're looking at the difference in what we were able to see with moving forward with January 8th, as we had more and more students who were coming back into an in-person learning model at the elementary. Roughly when we were in December, we had about 11%, and now we are, as of January 8th, at 31%. We are seeing a slower progression in the secondary model, and there was a reason for that, and that's because we really turned and focused our attention on additional mitigation strategies, specifically targeting our elementary and population for in-person learning. We can move forward, please. So when you remember, when we announced the Safe Learning Plan at the end of July, we identified that there were really 5 different goals we wanted to focus on. And the first was the most important, is really making sure that we are prioritizing the safety and health and well-being of our students, staff, and family. And second, it was always to prioritize in-person learning if we could do the first goal well. And if we could do the first goal well, and we needed to be thoughtful about what that was going to look like, we were going to turn our attention first and foremost to our youngest learners, and then also make sure that we are helping to support students who need who have the most need and need some additional support while they are in school. We also needed to make sure that we were recognizing the differences in the potential spread among different ages, support planning while we were trying to also permit flexibility for our districts. We know that there is not a one-size-fits-all model. School structures are typically the same, but they are very nuanced and different as you go from community to community. We also have seen the opportunity to have a number of our greater Minnesota schools have had the opportunity to be in person throughout the fall. And so there has been stark contrast. And so we needed to make sure we allowed for flexibility, and we needed to take into account the disease prevalence. Can you move forward, please? And so the Department of Health helped us to create really a model that walked through a 5-step process. First and foremost, relying on the county level data when we announced in July, and that was because we had not had any data. When our students left in March to do learning from home, we had very little data about what was going to be happening in schools, or no data to really make a decision. And so our Department of Health really worked to hone in on what was going to be the very best place for us to start, and then what additional data would we be able to use as we were going to walk through this process. Next slide. So we created in this process a regional support team structure because we knew that that school districts were going to need, school districts and charter schools would need additional help with being able to identify, now that we have additional data, what should we be doing with our transition models? We are not trained, right? As educators, we are not often trained health professionals as well. And moving into the support of a pandemic, identifying people who have COVID-19, moving into quarantine, are not things that always come naturally. And so we really wanted to make sure we had a structure that was able to support that. So in partnership, we created the regional support teams based out of our service cooperatives around the state. They include local public health officials, Minnesota Department of Health representatives and colleagues, Department of Education colleagues, and the service cooperative. And really they come together and help to support the incident command teams that are developed by our school leaders to help to make the decisions about, do we move to a in-person model? Do we need to move to a distance learning model, or when can we move to hybrid? And then what is the information that we need to use in order to be able to move that direction? And these are a number of things that they have been able to help with and support as we have been in this process for the last 10 months. And while they are thinking about like what that is going to look like and what their learning models are. There's a series of questions, and we've created a number of tools to really help our school leaders think through all of the different components, not only the academic, social, emotional, and mental health and physical needs of our students, but also recognizing the health components around COVID-19 and how do we know which model we should be in and the reasons why we should be there. And these questions help to do that. And so, thank you. And so, as we have learned more, we have been able to really be thoughtful about the structure that we have in place and things that we can do to help to mitigate the spread. We know that we need to continue to prioritize in-person learning and go back to that second goal as much as possible. We know that a number of our Minnesota students have had a full year of disrupted education and will go beyond that. We also know that there are short-term and long-term implications of not having all of our students in person. And it is staggering the impact that we believe that this is going to have on the academic progress of our students. And it's going to change, we know, the trajectory of some of our students' lives, whether that is through COVID-19 in and of itself or the byproducts of COVID-19. We know that that is going to have an impact, and it is going to directly impact the workforce, and it is directly impacting our workforce now. And so based on all of the knowledge that we've had and gleaned in our partnership with the Department of Health, we were really thinking about how is it that we can incorporate additional mitigation strategies to bring additional students back into our school buildings. And I think we want to sort of target a couple of things that we know, in addition to all of the things that Assistant Commissioner Huff talked about with regard to the school's role in the health and well-being of our students. We also know that there are the academic components. And when we think about our youngest learners, a place that we've already identified that we've prioritized, we know that they are developing their skills to be able to regulate their own behavior, their emotions, their attention, and then would have a likelihood with struggling with distance learning. Their interactions with another adult who cares about them is a really important component, as is having the opportunity to interact with other children their age. And so we know the importance of that and really wanted to be thoughtful about the recognition around, again, the other health implications that come with being in the midst of a pandemic. While we have one lane of really looking specifically at COVID-19, we also know the other risks that some of our students are facing. Next slide. Thinking specifically to academics, we also know the implications of third grade reading, right? That is something that this state has been focused on for a number of years and has passed legislation specifically around that. We know that third grade reading is oftentimes an indicator, not a predictor always, but is oftentimes an indicator of potential of graduation. We have seen there are studies that have been able to articulate that 88% of dropouts in several studies have also been linked back to having been struggling readers in third grade, and really building that foundational skills in your K through 3 and pre-K programming is incredibly important. And so building that foundation is something we want to make sure that we're able to continue to do, and is identified as another risk. Move forward. And that just reiterates what we also know about making sure that we need to continue to focus on how is it that we can get our students back in. So based on our understanding around our new knowledge around the virus, we were able to think through looking at what elementaries could be doing to be able to help to support the implementation of an in-person learning model if they have not already been able to do that thus far. So our mitigation strategies. First and foremost, we implemented a rolling start process, really thinking through how it is we're going to be able to bring students back into the building, and recognizing that having hundreds of students and staff members coming back into a building at one time didn't seem like the wisest approach. And so taking the time to bring students back in if they have not been in or had not been in a while, to rebuild those systems and structures and routines, to allow 3 grade levels at a time to really come in. And for 2 weeks, we have the opportunity to see where we are at as a building, and then make determinations about, are we seeing any increases in COVID-19 in our communities? Are we seeing it in our schools? It's a 2-week incubation period. That was a purposeful choice. And then allowing another group of 3 more grade levels to come in together. Also making sure that we were executing a testing program. We know that we have seen asymptomatic spread, and we want to be able to identify that and deter that. And so offering training, offering testing and saliva kits to our staff members is a really important component. One, because we can identify asymptomatic spread, and two, because it also helps to our staff continue to feel safe, and that we are trying to do everything that we can to protect them. I want to be very clear that this testing program is not required. We are not compelling people or not requiring people to participate in the testing program, but it is available to them if they choose. And it happens on an every other week basis. The state is divided into regions based again on those regional support teams and those service cooperatives. And every single region has a day, and it's a strategic process where logistically we're able to meet the needs of our school districts and charter schools in having this testing process. And that began on January 4th. The continued implementation of utilizing face masks in our schools and following the executive order around face masks and indoors is something that we have always had, but we also then added the strong recommendation about also wearing a face shield. The Department of Health has been very clear that their recommendation is that not only a mask, but a face shield is more likely to mitigate the spread of COVID-19 than solely a mask. So solely a mask is a really great mitigation strategy, but the addition of a face shield is something that's really important. Also knowing that we have staff who need to provide direct services is something that we wanted to make sure that they had the PPE that they needed to in order to provide those direct services to our students who are in need of additional support while they were at school. We can go to the next slide. For physical education classes, they need to continue to wear masks. It aligns with what's happening in fitness centers and what's happening within sports. Also looking at arts classes, we are trying our very best to be able to cohort our students and keep them in the classroom. We also know that there are times when they have more room to spread out in a larger class setting, whether that's maybe for music or art or media or STEM classes. And so if you can continue to keep your class cohorted and they have more space to be able to spread out to be able to participate in these classes, then they should do so in those rooms. In other instances, that there is a feeling as though staying in that classroom is a better choice. And so there really are the two options that are within that. And then the other piece where we do have a bit of a shift is our goal is to try to maintain that cohorted model, but we also know that there are some academic pieces or some social emotional pieces where the only option is to have essentially people from or students from a number of different a number of different grade levels or from other classrooms in the same grade level coming together. In the instances of like special education services, English learner services, gifted and talented education, as well as counseling services. So if you needed to pull together a group around counseling on a specific social emotional skill, then you may be pulling from 3 different classrooms in the same grade level. If that is the need, then the expectation is that they could pull them together, but they would need to maintain that 6 feet of distancing and they would continue to be masked. Also thinking about student meals. There are some who feel much more comfortable and confident, school districts who feel much more comfortable and confident having meals in their classroom because then we don't have students walking up and down the halls. They are not also commingling in the lunchroom. However, we have other school districts and charter schools who feel as though being in the lunchroom, they can spread out more. They can all essentially sit on one side of the table, cohorted and facing one direction so that there's not the opportunity for respiratory droplets, right, coming back and forth. And so some are choosing to use the lunchroom. So there are a couple of different ways that our schools are approaching that, but the recommendation is, of course, to have 6 feet of distancing when possible, especially because they are unmasked and eating. And then really just making sure that we are cognizant of the fact that since July in the Safe Learning Plan, the recommendation for in-person learning is that students do not need to be separated by 6 feet or by 3 feet. They can be a typical class size in an in-person model, but if at all possible, try to have at least 3 feet of space throughout the day for your students in an in-person model. And this just talks a little bit more about the rolling start. It talks about the 3 additional grade bands, which we've addressed, and a lot that really began for school districts who had not yet identified if they would be coming back in an in-person or in a hybrid model. Yesterday, for most schools across the state, if they had not already been in person or in a hybrid, yesterday was the first day where they would be able to bring more students back to in-person in this rolling start model. Next slide. And these are some examples of different ways that schools could think about it. These are only examples. They did not have to do it this way, but wanted to provide some context for people. We can skip the slide. The COVID-19 testing, again, is something that we are continuing to be able to offer. We have more and more schools that are requesting. We have roughly 150,000 tests that have been requested and have about 8,600 samples. We do not get their testing information. It does not come to the state. It does not come to the Department of Education. It is solely an individual test for that person. And any positive results are then passed to the Department of Health like it is with any other saliva test. We can move forward. This continues to talk about how this is done. Our school nurses have been remarkable, have always been remarkable, right? But especially as we are in the midst of a pandemic, they are doing, in addition to work around COVID-19, a number of them are now trained COVID-19 testers. And so they are really supporting their school districts and their schools to be able to do COVID-19 testing in their buildings. Next slide. And I think that it's also important to note that none of this is ever done in a vacuum, right? We recognize that we as a state are not the only ones who are experiencing a pandemic. We are seeing our colleagues across the state, as well as our peers across the world who are working through the pandemic. And so being able to look at other models and other mitigation strategies, looking at ourselves comparatively and really thinking about its impact on schools and what some of the other things that are happening, not only in other states, but across the world, gives us context. And so this is just an example of some of the other states and countries that we've had the opportunity to look at to really do some comparisons and be thoughtful about this process. And I know that one of the things that is relatively new is the community COVID-19 vaccine pilot. It was, as you know, announced on Monday for people that were 65 years and over, as well as for school staff and childcare workers. We were able to set up, in partnership with the vaccine work group and the Department of Health, 9 pilot vaccine sites across the state. 7 were identified for greater Minnesota, 2 were identified for the metro area. A couple of ways to think about the pilot is how this was distributed is there were roughly 1 box sent to every greater Minnesota site. And I think there were 4 boxes that were sent to the 2 metro sites, 2 each. And there are 975 vaccines in each of those boxes. They're not going to be opened. They can't be separated like that. Those are the total number of doses. So when we looked at the allocation, there were 12,000 doses that were available for 65 and older and school staff and childcare workers together. So that was initially then divided. 6,000 went to 65 plus, and 6,000 went to our educators and childcare workers across the state. I think there's another slide. So we then were able to say, now that we know, and just to be clear, we have approximately 240,000 educators and childcare workers in the state, and we have 6,000 doses that we are distributing this week. So then we took those doses and that box of 975, we were then dividing them amongst our childcare workers and our educators based on the total population who were in that region. And then from there, we're able to create the allocation across that region and then across the state. We sent the information out to our school leaders, and I just have to thank them for stepping into this work. They have, consistently done a remarkable job for stepping into this work, especially on Monday, to be able to move quickly to help to identify and prioritize staff utilizing a prioritization document. It was created in the partnership with the Department of Health, really looking first at the in-person learning model and the hybrid learning model. If you are in one of those models, the prioritization recommendation is in one of these 4 areas. Either it's your elementary school staff, it would be your staff who are providing school age care, who have done this the entire pandemic, even while schools have been in distance learning. We have also recommended the prioritization of early learning staff, again, going back to our main goals at the very beginning of the Safe Learning Plan, and our special education staff who are providing direct care and services to students. And so if you are in a distance learning model, the prioritization recommendation would be to first start with your school age care staff, as well as your special education staff who are providing those direct services. And then is the sub-prioritization. There are all of the other pieces that we really have to be thinking really about. We're talking specifically about age. We're looking at also considerations around other close contact positions, and also recognizing that there is a disproportionate impact of our communities of color and Indigenous communities. And that is also a factor to consider as you are prioritizing your staff. And so that is one of the ways that was identified. They then were sent an email so that the staff members knows that they were prioritized and that they could then sign up for the vaccine. They do not have to. So they would go in, they would put in their school, identify which school they are in, or which school district or charter school or tribal school they are in. If they say no, what they do is they first read the Tennyson waiver. So as we're gathering any private information, if they say no, they do not want it, we get a no, and then that is it. We don't know who that person is, but we know that somebody said no from that school, and now there's another dose available, and the rerouting of that information. If they say yes, then we take their name, their phone number, and their email address. That is then routed to the vendor, and then they will get a text message, and will again have the opportunity to sign up for. They will have the opportunity to sign up for their vaccine, and that would be for this week. Looking at that, our appointments are beginning on Thursday. So there are 4 sites that have pilots that are beginning Thursday that will run Thursday, Friday, and Saturday. There are 5 of the sites that are going to be on Friday and Saturday. And we did work with the vendor because we also recognize that these sites are also being shared with 65 plus. We wanted to be cognizant of making sure that we were conscious of the times of everyone coming in, and also making sure that we had times that were after a working hours or throughout the day on a Saturday to be able to do this work. When they are signed up and they come in, they are not only signing up for their first dose, but they are also signing up for their second dose so that they have appointments. It is a 3-week-long pilot. We have this week, we'll have the next week, and then we'll have the next. And then the 3 weeks after that are the subsequent second doses. And so we know that for the vaccines that we have available to us, there are 6,000 for our school age care and our education workers this week. And based on what we get in the allocation for next week, we will make determinations based on that. We are at the mercy at this point of what we are getting from the federal government by way of vaccines. And so we are looking forward to see what we would have available for next week. Next slide. And so we also just want to add that, the National Guard has stepped up and continues to step up in a number of ways, and we are appreciative of that. They are going to continually and currently are continuing to support the sites for vaccination. And so I think that is what we had to share with you today. Chair Dabney, I'll hand it back to you.
Chair Dabney, you're muted.
I try to sit quietly and then it undoes me every time I try to not sit quietly. My apologies. Deputy Commissioner, thank you for that. Assistant Commissioner Huff, thank you for your presentation as well. We're going to shift now to member questions, and I'm going to jump on the chair's prerogative, Deputy Commissioner Mueller, and ask the first question, actually the first 2, and it goes to the access for school staff to vaccines, and it's 2 similar but different populations. So I'm going to ask the questions simultaneously. What was explained to me was your access is determined by who signs your paycheck. So it's about if you're on the school district's payroll, you get access. My question then is two-part. What about those nonprofit providers who provide after-school care or before-school care, who are then not school district employees, but are providing care for those students in an in-person setting? And secondly, some school districts have privatized some services, nutrition services, custodial services. So again, they're in the buildings, they're dealing with kids, but they're not school employees. Do those two populations of adults in in-person learning buildings get access to the vaccine?
I was following suit. Chair Daphne, thank you very much for that. Right.
Thank you for that.
I'm your first follower. So, so Chair Daphne, thank you very much for that question. So what we did articulate in the prioritization and really who is identified within the definition of educators is a very broad definition, and it does include contracted services.
Okay, thank you very much.
Yes, thank you.
You've been patient. Thank you for that. Representative Erickson.
Thank you, Mr. Chair. I have a couple of questions. First, for Dr. Mueller, thank you again for your presentation today. You added some information after we heard in policy, so I think we really appreciated that. I'm wondering if there's going to be a subsequent presentation coming soon for you to outline how it is that you plan to have our learners catch up and to help our teachers help our learners catch up. I noticed that Tennessee has a very robust literacy plan in mind. Of course, it's going to cost, but they are really focusing on one of the major pieces, and you mentioned it indirectly, that our students have lost out on, and that's literacy. You know, K-3, as you mentioned, third grade reading is, you know, one of our goals, that our children be able to read well after they have finished the third grade. So will there be a subsequent plan presentation coming so we can learn about that? And then my other question is in regard to the document that Megan sent me, which is so appreciative, about the 29 districts, charters, and special ed consortia that stayed open for in-person learning from September 8th until now. Did you collect data from them in regard to what they did to prevent the spread or to ensure that their children were safe? Have you collected that data? So the two different questions.
Deputy Commissioner Mueller.
Thank you, Chair Dabney, and thank you, Representative. I think that, so to go back to your very first question, we would love to be able to come back and have a conversation with you. We hope to be able to discuss that more and have more opportunities to come before you and share a presentation, especially after the budget is released. And so we'd like to be able to do that, I think, first and foremost. The second is we really are wanting to make sure that I know Assistant Commissioner Huff, do you want to have the opportunity to talk a little bit about some of the mitigation strategies that we saw or had heard in data from from some of our school districts and charter schools that did stay in the entire time?
Deputy Commissioner Huff.
Thank you. Excuse me. Thank you, Chair Dabney and Representative. So we work with every school district through our regional teams. And we also, whenever we have cases, we do follow up. So everything that we have developed throughout this process has been iterative. We learn from what districts do. We learn from where there are failures and where cases people become infected and how that occurred. We also look at what does the research tell us. Every day we have more articles that are published on COVID and how it interacts with children, how it interacts in different environments. So I don't have the specifics for you. I'm happy to provide some specifics if you would like at a later date. But just to suffice it to say that yes, we have been working very closely over the entire period that schools have been in session to see how schools are doing it, how we can help them do it better, and how they can advise us in what is working and what is not working. As we know, every school district, every school building is different, and the mitigation measures that they use have to be tailored for their particular environment. And so that's part of what the regional support teams do, is to advise. We have epidemiologists who are then providing, being able to provide this technical assistance really at the local level. Thank you.
Mr. Chair, follow up.
Yes, please, Representative Erickson.
Thank you, Mr. Chair. Dr. Huff, as long as you're speaking, to what extent did you work with districts, whether they were the 29 districts, charters, and special ed consortia that stayed open or others, on air quality? Did you collect any data on what they did to determine that their air quality was making sure that this virus that was in the air was not spreading? Because I've looked at some different air quality systems. I know they're expensive, but even in my grandson's school, they open the windows and that provides better air quality. So, even in this wintertime when the winter is quite mild. So would you just tell us to what extent you might have, expressed concern for air quality as one of the mitigation factors?
Dr. Huff?
Chair Dabney, Representative, and actually it's just Mr.
Oh.
I don't have the specific answer to your question. I'm happy to follow up with that on, how we have tracked air quality per se. I do know that part of our safe learning plan is to address ventilation. As you mentioned, ventilation is important, and the more fresh air we have, then the less virus concentrates.
And Assistant Commissioner Huff, if I may add on, is that okay, Chair Dabney?
Deputy Commissioner Mueller, please.
Thank you, Chair Dabney and Representative Erickson. I think a couple of other pieces to note is, like Assistant Commissioner Huff said, it is included in our safe learning plan, and there were a number of school districts that did walk through an air quality process to help make some determinations around that. And as you said, it is a very expensive component. I think you'll be hearing from some of our colleagues in a couple of days. One of the additions to the new, the second round of ESSER funds is helpful and supportive around like air quality and some pieces and components that go along with that. So that may be something that you will also see some other school districts beginning to implement, because the funds can now be used for that, the new ESSER funds. So you'll hear probably a little bit more about that from our colleagues.
Thank you,
Anything
Mr.
else?
Chair.
All right,
No,
thank you,
thank you, Mr.
Representative
Chair.
Erickson. Representative Jordan.
Thank you, Mr. Chair. And thank you, Deputy Commissioner Mueller, for talking about how you're prioritizing equity with your vaccine rollout. I have some questions about vaccine allocations and as they relate to equity in particular. So can you tell me a little bit about how vaccine allocations were determined? So for example, the district that I have the honor of representing, Minneapolis Public Schools, I believe received about 84 vaccine doses. And obviously, we as a nation are facing a vaccine shortage. I'm hopeful that no, I'm not gonna say that. I'm hopeful that that'll be remedied by our federal government, as we've seen changes there. But can you tell me a little bit about how those vaccine allocations were determined, and can you talk a little bit about if community spread is taken into consideration with the vaccine allocations?
Deputy Commissioner Mueller.
Chair Dabney, Representative Jordan, thank you for the question. So I think a couple of different pieces were taken into consideration. First and foremost, we had 6,000 to disperse across the entire state. And so in that disbursement, then what we did was we looked at the total in between education and childcare, 6,000. And so we looked at each region. We took the total population of educators in that sector that are in pre-K through 12, as well as childcare, and looked at the number that we had in the box, which is 975, and had to then base it proportionally on that. We also knew that we wanted to ensure that every school district or charter school and tribal school, as well as private schools, had the opportunity to have access to some doses. There are some school districts, because of the size of the number of people in that particular region and the size of their school staff based on a proportionality metric, and we walked through that process, have 2 vaccines, right? So, and there's anywhere between 2 and 90. Now, our reminder about this particular piece is it is a pilot. This is not actually movement into 1B. It actually is in movement into the entire education and childcare workforce. It is a determination of how, like, we are going to be able to help to move this forward. And so that is one of the pieces that we kind of helped to articulate in that. The more doses that become available to us, the more that are shipped from the federal government, then those the capacity to be able to expand that is something that we have done. And that prioritization piece, I think, is a really important component. We do have, I think, that information is being provided or has been provided kind of on what that looked like in that partnership. But that was the way that it was divided. So it seems like a very small amount, right? 80 feels like a very small amount when you think about the size of and the number of staff available in Minneapolis. And we also think that the 2 is very small, right? And what we feel like is, we poignantly and ironically, we released this on Martin Luther King Jr. Day, and I think that the way that we're helping to phrase it and think about it, and it's one of my favorite quotes, is that if you can't fly, then you run, and if you can't run, then you walk. If you can't walk, then you crawl. But at least you're moving forward, and that is what we are doing.
Representative Jordan.
Yes, thank you, Mr. Chair. So can you tell me how equity was prioritized with this pilot? So correct me if I'm wrong, but the pilot sites are Andover, Brooklyn Center, Fergus Falls, Marshall, Mountain Iron, North Mankato, Rochester, St. Cloud, and Thief River Falls. Can you tell me a little bit about how equity, and it's particularly equity for both, and I know obviously I represent a lot of seniors who are very, very dependent on public transportation, and a lot of educators in my district and families as well who are dependent on public education or on public transportation. Can you talk to me about how equity was determined in creating these test pilot sites, and a little bit more about how that was taken into account? And when I say equity, I mean racial equity specifically.
Right. Thank
Deputy
you.
Commissioner Mueller.
Thank you very much, Chair Dabney. Thank you, Representative Jordan. So I think a couple of pieces. One, in looking at the 7 that were in the greater Minnesota, they are based on the service cooperatives. They are based on the regional support teams. That is where those 7 are. They are a place where most in those communities are used to, or in those school areas and regions are used to driving. And so they are within about an hour and a half of most of the school districts that they serve. The 2 that were identified in the metro region actually were in partnership with the operations center. And I don't know if Assistant Commissioner Huff has any additional information on those. Those are 2 that I did not, I can learn more about that. I wasn't in direct relationship with identifying those 2 areas. There are 9 service cooperatives across the state, but we did not utilize those. We weren't able to utilize all 9. We wanted to identify that. We really looked at the 7 for the greater Minnesota. And so I can certainly learn more about the other two sites and then come back to you.
Mr. Huff, do you want to respond to the 2 metro sites and the selection of those? I think that's the question that you were just lateraled.
Yes.
Chair Dabney, Representative Jordan, I don't have anything additional to add at this time. We'll be happy to circle back with you. Just to emphasize, though, that this is a very limited pilot, so that we can learn how to better do this. I think that we learned this with testing, and we know that in order to serve our community, we need to be where our community can reach us. If we are going to make sure that we're serving all of our Minnesotans, especially our BIPOC community members, we need to have sites located where people have access, whether it be they can walk there, they can bike there, or they can take a bus or train there. That's why our testing sites have been focused on areas that are available for transit, and in our neighborhoods, focused easy access. That's what we're going to be looking at in the future as we roll out more testing. But just to emphasize that this is really a pilot, but we can definitely follow up with additional information as would be helpful. Thank you.
Thank you. Representative Jordan, any follow-up?
I'll just say that I hope that we are really taking into account racial equity as we move forward with these vaccinations. We have seen that our communities of color have really taken a large brunt of this. And I don't just mean urban communities of color. We know that we have a lot of rural communities of color in Minnesota that have been devastated by this virus. So I'm hoping that we're taking that into consideration when we're thinking about school staff. So that includes not only our teachers, but our nutrition staff. So I'm glad to see they've been prioritized, but also our custodial staff, our ESPs, our SEAs, that they're all prioritized for vaccine rollout and that our families are thought of as well. So thank you for all your work on this. And I look forward to hearing more information about this.
Thank you.
Representative Drazkowski.
Thank you, Mr. Chair. Thank you to the presenters. I think Mr. Commissioner Huff's first statement about the reaction, the state's reaction to dealing with this pandemic is hurting students, I think was the most important thing that was said between the presenters I heard this morning. And so the best thing we can do is get kids back in school again. And I'm hearing this so much from my constituents. The frustration level just continues to grow. And it especially grows members and presenters in the face of the fact that we have vaccines coming to this state and we seem to be tardy in Minnesota in delivering the vaccines effectively. The states around us, at least out of the chute, I haven't looked for the last couple of days. I suspect it hasn't changed a lot. We're delivering their vaccines at much higher rates. We're at about 30% of what they were last time I looked. So why is it that we don't have these vaccines out and deployed right now, and we're waiting till inauguration day to actually get going? Can someone answer that question?
Commissioner Huff, I'm going to throw you the vaccine question, perhaps.
Thank you, Mr. Chair, Representative. I will assure you the inauguration has nothing to do with our planning. As you know, we have pivoted more recently as the federal government changed their guidance to us a week ago. Part of the pilot that we've talked about is as we explore how do we expand to a broader audience. Right now, just looking at our dashboard, it looks like we're at 40% of the doses that have been received have been used. You know, it is definitely a assembly line process where the doses are received from the federal government. They go directly to the providers who are providing those doses. They go to our hospitals, our local public health, our clinics. They're going through the PPP program, through the pharmacies. And we are looking at ways, how do we partner with those groups to make sure that they are moving the vaccine as quickly as possible? It is definitely a work in progress. I will add that at 60,000 doses a week, we are going to be slow. And we are really hoping to see that production ramp up. And so that we can have more people vaccinated as quickly as possible.
Representative Drazkowski, follow.
Thank you, Mr. Chair. Mr. Huff, Mr. Huff, the frustration is that it appears we didn't have a plan to begin with. And now you said we're seeing how we go. Is this a design build plan like we do for roads where you kind of design it as you're going along? Or did we actually have a plan in this state? The states around us are running us over. And as you mentioned, in the very succinct point that you brought up, this is hurting our kids. And we need to get the vaccine into people's arms instead of pandering back and forth about, well, we don't know when we're going to get more vaccine from the federal government. We aren't delivering the vaccine we have. So the question is this a design build plan, or did we actually have a plan to begin with?
Mr. Huff?
Mr. Chair, Representative, I think I would beg to differ with you on your assessment. However, Yes, we have a plan. The plan shifted suddenly because the federal government changed their guidance suddenly. It also changed again because we thought we were going to be receiving more doses and found out that those doses were not available. There are a lot of things changing, but yes, we have been planning, and we're also have to be flexible with our plan. I am happy to. I know that we've had a number of presentations to the legislature from our infectious disease director, Chris Haresman, Commissioner Malcolm, who are much more intimately involved in the vaccine process. And I don't want to speak for them because they have just a lot better handle on everything that we're doing on vaccine, as they're the leads on that.
Representative Drazkowski, any further questions?
Thank you, Mr. Chair. No further questions. Just a comment, Mr. Chair. You know, as it's been pointed out earlier, kids have a better chance of getting run over by the school bus than they do of dying from COVID. It's the adults in the classroom that have provided the political breaks, if you will, to our schools moving forward to in-person learning. And if we're going to get there, we got to get these adults vaccinated and get it done quickly so our students can get back in school. And I hope the administration is hearing that message because, again, Minnesota is tardy. Thank you, Mr. Chair.
Representative Youakim.
Mr. Chair, and I want to thank MDHMD for the comprehensive report. I know this hasn't been easy for anybody, and it won't be easy until we finally get some more vaccines in our state. Just want to remind folks that teachers started back at school in person on Monday in a lot of our districts without having the vaccine. Our teachers, speaking as a mother of a new teacher, a wife of a teacher, a sister-in-law of 4 teachers, they're very excited to be back with the kids, despite having the vaccine or not. And a lot of our districts were working in person, and our schools have been open since March. So just a reminder that I think tensions run high, but folks are doing the best that they can. My husband was in person since March without a vaccine, even though he's quarantining in our basement this week because he was exposed at school. So I think will be happy when we have more vaccine in people's arms and we can get back to what we're used to seeing with our kids in person. But I also don't want to lose track, and I think Chair Dabney's talked about this too, is COVID's highlighted a lot of the disparities that we have in all of our delivery systems. And I think we would be remiss if we did not look at how we can reimagine the delivery of our education to all of our students. So I look forward to our committee kind of focusing on that moving forward. And thank you.
Thank you, Representative Youakim. Any other questions from members? Seeing none, Deputy Commissioner Huff, any closing comments?
Thank you, Mr. Chair. I definitely appreciate the desire to have vaccination move more rapidly. That would be nothing better than for the Minnesota Department of Health to know that everyone is vaccinated. At the current rate of allocation from the federal government at 60,000 doses a week, it will take 3.5 years to vaccinate the state of Minnesota. That has nothing to do with the state. It has nothing to do with Minnesota Department of Health. It has to do with the federal allocation. And until we have more vaccine, we can't put it in people's arms. We have a number of priority groups. Our plan has always been, we have prioritized long-term care residents because they are the most vulnerable. We have prioritized our healthcare workers because they are the most at risk and we need them the most to be able to fight the pandemic and to make sure we're staffing beds. And we know that elderly people, those 65 and 75 and over are more vulnerable to the disease and so suffer more severe outcomes. And the first group prioritized outside of those groups are educators, our schools. That is the very top priority of folks that are not in those high risk categories. And we continue to roll that out, which is why we have this pilot right now, so that when we do get more vaccines from the federal government, we can roll them out as quickly as possible. That's part of our planning process. I will also add, we as a state have had to balance many issues. COVID is a very serious disease. We will likely hit 6,000 deaths soon in Minnesota from COVID. That's a tragedy. And anything that we can do to limit the spread of the disease is what we have to do. And unfortunately, just like all of us in Minnesota, our children have suffered from this disease. I would say that it is the pandemic, not the state's response to the pandemic, that has caused children to suffer. We have a difficult balance to do. We have to make sure that we limit community spread. We know that children are less severely impacted by the disease, so they suffer less severe disease when they are infected. But we also know that children are infected and they do spread the disease. And we know that adults that they work with are at higher risk, but we also know that the way this disease spreads is when more people interact, they spread the disease. Schools can be a place where disease can spread, just as any other setting that we have where people from different households are interacting. And that's why it's so important that we maintain masking, good hygiene, social distancing, all the things we've said from the beginning, to make sure that we keep the spread low to protect those who are most vulnerable among us. And we so grateful, we're at MDH, we're so grateful for the support of all of you at the legislature as we carry forth that message. Thank you.
Thank you, sir. Deputy Commissioner Mueller, any closing comments?
Chair Dabney and members of the committee, we just want to say thank you. I'd like to echo Assistant Commissioner Huff's thanks for the support that you've given, not only for each of our agencies as we're doing this work, but also really thoughtfully around our communities of color, our Indigenous communities, our students, our families, and our staffs who are working in our schools. The very best place for our students to be is in school, and the very best place for our staff to be is in school. We do know that there are some students who are thriving in a distance learning model, and that means that we've learned something, right? And so as we walk through all of the negative pieces that are coming out of the pandemic, we are also learning something in the process, and we will be better. And so this gives us the opportunity to not only think about how it is that we can be better, but what are the systems and structures that we can put in place to ensure that we are returning to that better. I think that we also want to just say thank you for your continued commitment to our students and to our their families and our staffs and educators, because they want to be in school. They want to be with their students, and they want to do this work consistently. That is why we went into education. It wasn't to teach from a distance. It was to build relationships. It was to build the social emotional learning of our students, as well as the academic learning of our students. And we will always prioritize that. That has come through with a safe learning plan, and we are doing everything we can to be able to help to ensure that second goal. But what we have to be able to do first and foremost is the very first goal, and that's making sure that our students and staff and families are healthy and safe and well. And so we'll continue to work together with our Department of Health, continue to work together with you and our agencies across the state to ensure that we are going to be able to do that. And we are looking forward to the day when we can not have this pandemic rest on the backs of our children.
Thank you both very much for coming and testifying today and providing the information you did to the committee. Members, with that, thank you much for your time and attention today. We are adjourned. Have a good rest of your day.